we really need this. And this is what we tend to focus on. Big clicks and cracks from varying different positions by a multitude of therapists. But do we actually need these big audible sounds to actually make a difference? So that question gets asked to me all the time by students and practitioners across the world. Now I'm going to tell you this now, guys. You do not need to hear a click for the technique to be effective. If you are chasing the sound of a crack with your manipulative techniques, that is ego. You don't fully understand the neurophysiological mechanisms of manipulation. It's the wrong way to look at the treatment, okay? If it clicks, great. If it doesn't, no problems. We test, we treat, we retest. We look to see if there's been a tangible change or a reduction in tone or a reduction in symptomatic pain. We look for these aspects that manipulation can help us to temporarily induce. But we don't chase the crack. Because guys, if you are adamant on getting a manipulation and desperate to hear that sound, then your whole treatment is going to be biased. It's going to be based around that one tiny aspect of the whole process. Your patient will then assume that the treatment has been ineffective if you don't hear the click. You will think you're rubbish if you don't hear the click. But neither is true. The technique may have been fantastically effective. The patient may be moving and feeling better, but you may not have heard the audible cavitation. So remember guys, the manipulation is putting stimulus into a specific area. We're eliciting a cascade of neurophysiological responses. That's what's going to give us the positive benefits. Don't chase the sound of the crack because we don't need it, okay? If it happens, great. If it doesn't, don't worry about it, okay? Remember, when you're talking to your patients, you say to them, I'm going to put a technique into this area. It may or may not click. That doesn't mean the technique hasn't been effective.